Hey, hello, good evening. I think people are logging in. We were having some camera issues, but I think that's being solved. At least I can turn on my camera. I think Dr. Taylor can turn on her camera. So we should be ready. Okay. So good evening, and thank you so much for joining us today for a webinar discussion called COVID Real Talk. I am Dr. Rojas, professor of social work at Central Connecticut State University, and I will be the moderator for the discussion. Today's discussion will be around the topic of COVID and answering some concerns that the community had expressed in a survey that we conducted last summer in a community event. um, People express concerns about vaccines, about variants of the virus, about how do I protect myself, mask wearing. And then our community health workers also have been in constant community outreach with the community, and the community also has expressed some concerns. And so we kind of decided to host this event to answer some of those questions and to try to just provide people with proper information on how to protect themselves and how best um, try to fight the virus. So tonight we have it to create a discussion. We have Dr. Taylor from the Village for Families and Children, and the following YWCA and community health workers as panelists. We have Daniel Lix, we have Sumai, who's a community health worker supervisor. We have Madison, we had Alina, we have Itzel, we have Kwadi, which is another YWCA community health worker, and we have Tiana Lee. Um, so before we dive into our discussion, I wanted to let you all know that we have reserved the last 15 minutes of today's discussion for Q&A. So if you have any questions you would like to post to our group or individual panelists, please submit them via the chat. So there's a chat on the side. Please put your question there, and we'll put those together for the end of the Q&A. All right, so let's dive right into it. So I'm going to ask Dr. Taylor the opening question. Dr. Taylor, can you briefly explain how misinformation and myth affect communities of color as it relates to COVID-19 and the COVID-19 vaccine for those who might not be familiar, and why does it matter to you?
Hi, Dr. Rosen, and hello to everyone. I so appreciate the opportunity to be able to be with the group today and be able to talk about this very important topic, and especially thinking about the impact that COVID and misinformation myths have had on communities of color. It's significant, just being real. And so I look forward to being able to have a real discourse and being able to answer any questions, but also to hear more, because I'm so excited to hear what the young people who are on the panel are here to say, as well as really learn from everyone. So, I had to write this answer down, to be honest, because it's such a big question, right? Historically, people of color have been at high risk for misinformation in general. And the reason we are kind of particularly targeted for misinformation and myths is because we've been mistreated on all ends, right? The medical community has treated Black and Brown communities as objects and overtly hurt our bodies and minds. And that memory of mistreatment is passed down through generations. So we can think about Tuskegee, we can think about the mistreatment of women in Puerto Rico, we can think about all of these historical events in which, we were considered bodies for science, right? And not as humans. And so that impacts generationally. But then even today, people of color, when we go into a doctor's office, we have to be aware of the risks of poor treatment based on skin color, language, and even the name we might be given just before they even see your face, right? And as a physician, I'm acutely aware of this and really make it my mission to make a difference in medicine so that these kinds of things can change. But it is both generational, historical, and very present today. In addition, we talk about actual interactions with medicine, but if we think about research and research protocols, there's racism and there's issues within research protocols in which they don't even consider or include people of color in their design, right? And then even much less communicate with us on what cutting edge technology might be out there. So then when medical experts want to speak on new treatments, we're not going to trust them. We anticipate that we're going to be guinea pigs or that we're going to receive the leftovers. While we turn away from the medical community, we believe that we're protecting ourselves. So we think that if we're not going to listen because we're not going to put ourselves at risk of being mistreated by the medical community. We're saying I'm keeping myself safe. But actually what we wind up doing is we open a path for others who are aware of this mistrust of Western medicine to come in with ideas that are false and present them as truths. So they come in and they present themselves as trustworthy, they diminish the relevance of science and present to us false information using what appears to be logical lines of thinking. So they kind of bank on us not checking their claims because they're so distrusting, because we are so distrusting of medical science. But sadly, just as we have experienced mistreatment in the medical community, these claims are also killing and harming our communities generation after generation. So this happened at a really high rate with COVID. You know, there's the whole Nicki Minaj's cousins, friends, uncle, whatever, and example, but I'm also sure that each of us can sit and think about a claim made by a cousin or an uncle regarding the dangers of vaccines and its treatment and the treatment for COVID. So we have this sort of combination of historical present racism within the medical system and groups that are really trying to take advantage of us needing to protect ourselves and our mistrust of medicine. And then we have this rapid appearance of this deadly virus, severe illness, and then the ineffective efforts of the scientific community to speak to our communities. So misinformation is just everywhere. And it's become very effective in convincing people to not do what everybody else in the world is actually doing, right? We're not even just talking about the US. People are getting vaccinated across the world. And what has happened is it's worsened the effect of COVID directly and indirectly on Black and Brown communities. So I have so much more to say, but I'll leave it at that, knowing we have a time constraint.
Thank you, Dr. Taylor. Any of the panelists wants to add something before we move on to the next question? If not, we move to the next issue. And the next question is going to be asked by Danielise. So please go ahead.
Hi, my name is Danielise, and my question is, if I am in close contact with someone who tested positive, but we were both wearing masks, do I need to quarantine? If so, does that mean masks don't work?
I am muted. Thank you so much for that question. You know, the truth is that there are different types of masks and they provide different levels of protection. So it's important first to figure out what is considered exposure. So I really want to be able to state that really clearly. A good measure of exposure is someone without masks, two people in a room or people in a room together without masks, closer than 6 feet for 15 minutes or more. That is what we call enough time for the virus to actually cause infection. And we're talking about baseline without masks. Getting COVID isn't instantaneous. Is it more contagious than most other things that we can contract? Absolutely, but it isn't instant. The media will make it seem as if you can walk by somebody and suddenly you have COVID, right? It is not that. But so it requires exposure to a certain amount of the virus, what we call viral load. And COVID is an airborne virus. So it's something that has to be passed on through the air. So coughing, sneezing, talking, laughing, but the virus is carried in that manner. So you need to have enough of the virus reaching you in order to get sick. When you put a mask on, it reduces the exposure that you can have to the virus. So the type of mask makes a difference in how much virus you might be exposed to. Cloth masks only offer a little bit more protection than no mask at all. Procedure masks, these are the medical ones, the ones that are disposable. They often come as blue and they have the metal piece around the nose and the loops, are better and provide more protection. And then the highest level of mask available is called an N95 or KN95 mask, and those provide the greatest amount of protection. N95 masks are what are used by nurses and doctors who are directly working with COVID positive patients in order to keep themselves safe. So just to kind of give you an example, surgeons who are operating on COVID positive patients who, they're wearing an N95 mask to keep them protected. And there's a lot of up close, really intense contact with patients when you're in a surgery, for example, or in an ICU, for example. So a personal example is throughout the pandemic, I've actually worked directly with children who I know are COVID positive, both in the hospital and in my current position at the Village. And I wear an N95 mask. To my knowledge, I've never actually contracted COVID. I feel very fortunate, and I also have worked really hard to make sure that I can be safe when I know I have a risk of exposure. So I've been up close with kids who have COVID, but I have the right mask on to keep myself safe. But just to be real, whatever mask you're willing to wear properly is really best, right? So if you can wear a procedure mask and you can keep it over your nose, you can cover your mouth, then that's the best. N95 masks can be really hard to keep on, right? Because they're much more constricting of your breathing. So if you're unmasked and the person with COVID is unmasked, and you're together for 15 minutes or more for less than 6 feet, yes, you should quarantine and test after 5 days from the exposure. But you have to think about all the different combinations of what would be considered an exposure in order to determine the quarantine.
All right, thank you for that. Any other follow-up questions from the panel or any other comments? All right, if not, we're going to go to the next question. Thank you again, Dr. Taylor. The question is by Sumai. Please go ahead.
Hi, my name is Sumai. My question for you, Dr. Taylor, is if if someone tests positive for COVID, do they need to quarantine for 5 days versus the original 14 days? Especially now that cases are rising, like what's the reason for the change?
Yeah, Sumaya, it's really confusing, isn't it? Like we started off with 14 days, people are out of school and work for long periods of time, and now they're like, hey, no, it's cool, 5 days. This actually is based on science and based on what we've learned and understood about the virus over the pandemic. So the key though is it's not just quarantining for 5 days and then you can be out with people. The key is if you are not sick, if you don't have symptoms. So if you've been exposed and you're quarantining and you remain without symptoms at the 5 days, then you can go out of quarantine, but you must remain masked, okay? And the CDC changed the rules for quarantine for several reasons. First off, we have the vaccines. And while you can get COVID if you're vaccinated, the chances are actually still lower of contracting the virus for those who are vaccinated than those who are unvaccinated. So there still is protection. It's not nearly what it was with the other variants as it is with Omicron, but there's still protection. Additionally, illness is greatly decreased if you're vaccinated. So you're less likely to get really sick if you're vaccinated. And another reason why the CDC changed the timeline was because requiring 10 or 14 days of quarantine for those who are exposed but not sick led to a lot of negative outcomes. And just being very real, it particularly hit Black and Brown communities, because what this did was it kept people out of work, it kept kids out of school, and it kept healthcare workers from being able to help those who were sick. Many of the folks wind up not having COVID, but they're still out for 14 days. And then they also had a 10-day requirement. It's this reason, though, that there's further requirement of wearing that mask beyond 10 days if you're exposed and not symptomatic. And then you test at 5 days, at day 5 from your exposure. If you start to get sick, you go into isolation, you stay away from folks, right? And then it changes, right? So then the key is, do you have symptoms? Are you sneezing? Are you coughing? Are you noticing anything else? Aches, muscle aches, fatigue, those are the kinds of symptoms. If you start to have those, you need to go back into isolation and not be around folks. If you haven't tested yet, because it's not yet the 5 days, stay to yourself. If you're sick, wear a mask, stay away from folks.
A follow-up to that comment. So, because now we, there's a flu season, right, and cold, and let's say, I have symptoms, so I immediately get tested negative, but I feel sick.
Yeah.
And then for a few days, especially with the at-home test, I keep testing negative for COVID, but I still feel some symptoms. So then it may be indicating that it's not COVID, but something else. How do we do about that? Where we keep testing negative, maybe, but so we treat it like for safety with the longer period, or we say, well, I'm kind of sick, but it doesn't seem to be COVID. How do I proceed?
I think just making sure that you're wearing a mask. If you're continuing to test negative, so most of the rapid at-home tests, once you start to get sick, are sensitive enough to tell you have COVID. If you have COVID, that's where that day 5 is really crucial, because then you have enough of the virus in your body for it to be detected by the rapid tests. The best test is the ones that you have to go out and get, the PCR ones, where you have to go to like a CVS or whatever, and then they give you the results in like 1 to 2 days. That is the most sensitive test and the most reliable. But if you're using the at-home test, which most of us are at this point, just being real, then you test at the 5 days, you're negative. If you're still feeling sick, I actually agree with what you're recommending, which is in 2 to 3 days to test again, just to double check. But if you're negative, wear a mask, because the reality is the flu is a problem too, right? The flu is contagious too, cold's contagious too. And so I would just continue to say, make sure that you're masked when you're around folks when you're sick.
Thank you for that, Dr. Taylor. So let's move on with the next question. And this is going to be from Madison. Madison?
Hi, my name is Madison, and my question is, how do viruses mutate into different variants, and will it stop mutating?
Hi, Madison. This was a cool question, and I really appreciate getting this stuff, the questions in advance, to really be able to give thoughtful responses to them. Because this is really confusing, right? Like, we had the original COVID-19 virus, then we had actually a few variants in there that didn't actually have a really big difference. And then we had Delta, and now we have Omicron, and we're just going straight up the Greek alphabet, right? Well, the reason we see these changes in the viruses and why they seem to have a different response in our bodies with regards to how contagious they are or how sick they make us is because that viruses actually have their own genetic code. Just like our cells contain DNA, the COVID virus contains RNA, which is the code to tell the virus to do what it's meant to do. Genetic codes, including our own DNA, go through changes when they try to multiply or replicate, right? So when they try to make more of itself, you can actually cause there to be changes through mistakes, through mutations, right? That can happen as it makes more of itself. Our cells have a really cool several step mechanism to prevent a lot of changes in our DNA, because how awful would it be if every time we had to make a new cell, which we're doing all the time, all of a sudden you can't rely on the genetic code being the same because there's some mutation. Actually, cancer is a version of how that can kind of get out of whack. For viruses, they don't have those safeguards. They don't have those things preventing it. So they wind up just kind of making all kinds of mistakes all over the place. Sometimes the mistakes cause the virus to be less effective at what it's supposed to do, and then that virus dies off. Some changes cause the virus to be more effective, either because it infects more people more quickly, or it does whatever it's meant to do within the body more effectively, and those keep going. So for example, mostly viruses, their whole purpose is to find a host, which in our case would be humans, it could be animals as well, and like make more of itself, right? So if your host dies really fast, it's not that great, which is why actually the most common course of most viruses is to cause less death, but to be continuing to be able to be spread more widely. That's actually what happened with the flu, is it was extremely deadly and has become less and less so, right? That's what's happened with a number of other cold viruses, is that they were more deadly, but over time, the mutation that survived was the one that could get passed on so it can continue, but didn't kill off the host humans. And so the hope is that COVID will follow suit, and that COVID will similarly become less and less severe as far as illness goes, and will unfortunately just be another thing that we're having to deal with, but we're not having to alter our lives so much because so many people aren't dying from it.
Clarifying follow-up to that, how is this issue of mutations, which is concerning, right? Because we're getting vaccinated, but the virus seems to be keep mutating, related to those issues of unvaccinated, but not in this country, even though, like, right now there's a lot of vaccines in the United States, in Europe, but a lot of the poorer countries are not getting the vaccines. And it seems that it is there that people get getting sick and the virus keeps mutating. So how is it related to us as a bigger countries to keep trying to get people and sharing the vaccine to avoid this issue of mutations?
Oh man, yeah, that's a global public health issue, right? And the thing that is interesting is, you know, in the US, we're so US centric in our view, right? And there's so many arguments within our country about vaccination or not vaccination, mask or not. But the reality is that because this is something that impacts the entire world, what happens in South America, what happens in East Asia, what happens in Africa, Central Africa, all of that still affects us because we're not as isolated as we used to be, right? We are all people everywhere. And so viruses are having a grand old time because they can just get passed on. So as individuals are getting sicker and the viruses are able to continue to be passed from person to person to person because of the unvaccinated and lack of access to vaccines in poorer countries, that yes, the variants keep coming, right? And that's how it then winds up coming over to us. And you can actually see a pretty common trend where it will start in a country, it'll pass on to Europe is usually the first one because Europe has so much commerce that happens and so much traffic, international traffic that happens. And then it comes over to the US. And so that's actually how a lot of folks are actually looking at where the significant variants are and what's the course of the illness by the time it gets to the US, because it's already passed through several other countries. And so the US is taking some measures. We could definitely do better of trying to, of donating vaccines and also trying to influence the pharmaceutical companies to make their recipes, essentially, how they make the vaccines, able to be replicated by other countries in a less expensive manner. There's been such, ability for that to happen, but there are a lot of scientists that are really trying to figure out workarounds. So I'm really hopeful that the international scientific community is going to sort this out. But there's a lot of money in this, and a lot of people want to protect that, to be real. And unfortunately, it's negatively impacting the entire world.
Thank you, Dr. Taylor. Next question comes from Alina, please. Thank you.
Hi. Hi, my name is Alina, and now that it is recommended for everyone to get the booster shot, will we have to continue to get it every 6 months or every year?
Yeah, hi, Alina. So we still don't quite know. A lot of scientists have actually said that the mRNA vaccines, which are like the Pfizer or the Moderna ones, were actually always meant to be a 3-dose vaccine in order to reach the right level of immunity. So there are other vaccines that are similar to that. A good example is the Hepatitis B vaccine. Probably the most of y'all in the room got that Hepatitis B vaccine when you were literally the first day of your birth, the first day you were on this planet, and then when you were a few months old, etc. But it's a 3-series shot for hepatitis B because that's how many vaccines were necessary to reach the right level of immunity for protection. And they were able to figure that out. They think that is likely the reality for the mRNA vaccines. But others think that this might wind up, because of how many mutations this virus has, could wind up being a kind of an annual, like the flu vaccine type of situation. Unfortunately, that all still really remains to be seen, and whether or not that's going to be necessary in the long term. But we're going to have to continue to watch what happens with the variants, and whether new vaccine development can make a difference as they change the mRNA vaccines to meet the new variants. But the technology for the mRNA vaccines are really, really exciting, and they're able to see how it can be effective for other diseases, other viruses. But it's still something that they're sorting out as far as the actual immunity level for COVID at this point.
Thank you, Dr. Taylor. So we have gotten to the halfway of our panel, and we want to hear from the audience, right? There's a poll that we have a very 5 short questions that some of the people who are listening, if we're gonna, I think, put it up, right? And if you can answer some of that, because we want to hear from you with this. Is a very short poll. So if you can fill it out and tell us any other questions you guys have, because we can add those, you know, to the chat and to the thing at the end. So I think, right, the poll should come up, right, that right there. So again, if you are hearing this and you are seeing us, please answer that, and we'll collect the results, and we'll continue. So I'll give you, I don't know, a few minutes to try to fill this out. And we're not going to go anywhere, but I'll give you 2-3 minutes to answer this, and we will continue. We cannot vote, so it has to be whoever's on the audience, and we'll continue in a minute or two. Okay.
Can we see the chat questions? They're gonna show us the answer. Yeah, that's the question, but no questions is gone.
I'm going to keep it up for another minute, and then we'll continue. So again, feel free to give us some feedback, and we'll go on. We are going to continue. And so the next question, thank you. Oh, here's the results of the poll, right? They're sharing with you. At least the people that answered, we have most people who have been vaccinated. Most people chose to protect themselves and their family. Some people for traveling, we can see some of the results to help my community get back to normal, which is good. Um, Again, most of the people they answer, 5 people are vaccinated. Um, People are concerned about variants, and we just answer a question. We can keep talking about that again. And then about leadership in the community, trying to do a good job. We can see the results there. And again, most people here trust the advice, so Dr. Taylor will be happy to hear that at least most people here are interested in what she has to say, right? So let's continue. And the next question comes from Itzel. Am I correct? Yes, Itzel.
Hello, my name is Itzel, and my question, from your medical experience, do you believe that COVID will end soon? Why or why not?
And it's I hope so. Just to be honest, it's exhausting, right? We're all so tired, and it's caused so much damage on so many levels, right? And there are signs to suggest that to be real, COVID's always going to be a thing. But what ultimately the hope is, based on what we're seeing with the trend of the virus, is that it'll become less deadly and require fewer preventative measures, like mandated mask wearing. But we're still not able to be certain. This virus is behaving differently than we've seen in a very long time, and it's much more robust than we've seen in a long time. So we can really hope, and it seems that the scientists around the world are really investigating and studying it to such an intense degree that we're eventually going to get to a place where we're going to better predict its behaviors in order to affect what impact it has on society. But I'll be honest, there's no certainty around it at this point. But there are lots of people who really feel that Omicron, while was so incredibly contagious, because it didn't cause as much illness, is really the first step in a pattern of progressive improvement in the outcomes if you get COVID.
All right, thank you. Anybody else has a follow-up to that or any other question? If not, we're moving with the next question, and it's from Jadis.
Hi, good afternoon. My name is Claudia, and my question is, if I'm vaccinated, why do I have to wear a mask? And what masks are best?
Did you say Claudia?
Claudia.
Claudia, I'm so sorry. Hi, Claudia.
That's right.
Thanks, Claudia. So right now, infection rates are so high that mask wearing is recommended for everybody, regardless of vaccination status. So this is a way to reduce further spread of the virus. You can rely, though, on the fact that if you're vaccinated and boosted, if you're more than 5 months from your second shot, you will not get as sick, and your chances of death are extremely low, including with the Omicron variant. And honestly, severe illness and death is the biggest issue with COVID. Humans get infected with viruses all the time. But COVID is the deadliest virus that we've seen in generations. So getting COVID is terrible, but you can prevent death, severe illness, and even what we call long COVID when you're vaccinated. But I talked before about masks, and I appreciate the graphic that you guys put up for me. Different masks have different levels of protection. So cloth masks provide a little protection, more than unmasked. Procedure masks, or those disposable ones that the medical ones are better, and then the N95, K95 provide the most protection. So wearing a mask when you're sick protects more than when other people are wearing a mask and you're sick. So for example, and you can actually, not in this particular graphic. Yes, in this particular graphic. You can see that there's a big difference in masking based on whether the person who's sick is wearing the mask versus the person who doesn't have COVID is wearing the mask. So if no one's wearing a mask, the risk of transmitting, and this is less than 6 feet for more than 15 minutes, again, that's our baseline, right, is 90%. If the healthy person is wearing a mask, it goes down a little, by 20%. And then if the person who is wearing the mask is sick, this is a regular procedure mask, the transmission goes down 5%. Down to 5%, and then if both, it goes down to 1.5%. So it's pretty dramatic, the difference that can be made. And this rate of transmission changes based on the type of mask. This is based on the procedure masks, but the N95 is a whole other ballgame. So we had talked about 15 minutes, 6 feet for maskless. For the N95s, if both people are wearing an N95 and one of those individuals has COVID, you actually can be around each other, close to one another for less than 6 feet for 25 hours straight and not have enough virus transmitted to get sick. So just as an example of that. Yeah.
Thank you.
Yeah, I think I answered all the questions.
Yeah, and I don't want it to get too complicated, but the issue of, you mentioned before, the issue of time exposure also gets added to that percentage, I imagine, right? So 90%, if I sit down with you and talk for an hour, definitely. But if, I don't know, if it was a short, maybe conversation, hey, how you doing? You might feel panic, oh my God, because you called me and say, I got COVID. Yeah, but I don't know, it was just a quick, I mean, it's still percentage, but I imagine that you add the time of exposure, then it becomes a bit more, I don't know, complicated in regards to who gets it, who doesn't. Am I right?
No, that's exactly right. And that's why that 15 minutes is our limit, right? Because really you have to have enough of the virus sort of in the air and taken in by the other individual for them to get sick. So, people get very anxious at supermarkets, but to be real, unless you're like right up with somebody for a long, and like shopping right alongside them the entire time, which would be super creepy, that you're not gonna get COVID just by standing next to somebody briefly picking up an apple from produce. But it does feel that way, right? Like what we hear everywhere is really like, it's like you can get it so easily. But it's not that. I mean, I think the only caveat to that, the only difference would be if you kiss somebody or you like super long hug somebody that was positive, then especially the kiss, yeah, you're exposed. It's just a very different situation. But if we're just talking about casual sort of interactions with folks, no, you're right, Dr. Rojas. It is just saying hi to somebody doesn't mean you get exposed.
And that's why the holidays, we were concerned because you're sitting down with family for 2-3 hours in a place. So it wasn't not to do it, but make sure that, everybody's tested or somehow, because that long exposure in the same environment, that's where it gets transmitted. Again, if somebody gets it and what have you.
Yep. And that's why we always see a big bump in the numbers after holidays, especially our big ones like Thanksgiving and Christmas, is because that's exactly what's happening. Is people are, you find your bubble, right? And you're like, everything is fine within my bubble, but you don't know. And you can't know. And fortunately, people then find out, 2 days later, I got sick, I'm positive for COVID. And so it's in those situations, actually, yeah, you are more vulnerable, but you want to make sure, if folks are vaccinated and you really kind of help people understand, if you're sick, it's okay, we'll find another way to be together, right? And those are measures, but you do want to still be with your family. We've been through this for 2 years now, right? And people haven't seen, parents or grandparents and that kind of thing. And we have to think about that balance. And if everybody is vaccinated and you really are being thoughtful about it, the real risk is quite low of again, we have to talk about the illness, severe illness and death. Can you get COVID? Yes. But are you likely to die? No, super no. The risk is extremely low. Are you likely to get so sick you wind up in the hospital? It's possible, but it is dramatically lower if you're vaccinated, and again, boosted if you're 5 months or more from your second shot.
All right, thank you for that. The next question is coming from Tiana Lee, please.
Hi, my name is Tiana Lee. My question for you is, how can I get an at-home test, and when should I use an at-home test?
Hi, Tiana Lee. So many towns are just giving them out. So there's been a federal and a state level response of making sure that people have at-home tests. And so right now you can even order them online and get free tests. They'll give you 4 free tests per household. All you have to do is request them online at www.covidtests.gov. You can buy them at pharmacies, and you can get them online. There was a period around the holidays where it was impossible to get any kind of tests. It's actually really easy now. They're stocked at most pharmacies at this point because people are getting them free from the state. They're just so readily available. And in addition, insurance is reimbursing. There's a new law requiring insurances to reimburse for the tests that you buy. So those are all real big incentives in making it easier to actually get the at-home tests. But you have to be careful, right? Wherever there's money to be made, you're going to have people that are going to try to get over. And so I also recommend checking the FDA website to make sure that the test you have is approved. So the test itself should say that it is FDA approved, and it will say EUA FDA approval. EUA means emergency use authorization, meaning the FDA has said, we've evaluated this test and how valid it is, how good it is at testing for COVID. And we've decided that it's good enough that it can go out and be used for an at-home test. You also want to check the age for it. So, I think most of the folks that are on this in this meeting are over 14. But if you have little ones at home, there are a lot of tests that will say it's only approved for 14 and older. There are some, like the one I actually really like is called the Binax Now, and you can order that from Walmart. And that is 2 years old and older. And so obviously if it's a child, you're not going to have the child do the test themselves. It needs an adult to follow the instructions. But you want to also make sure that you're paying attention to the ages on that. And I believe in the chat, yeah, we have the 2 websites. There's the one, and then there's if you could put in the www.covidtest.gov in the chat, that would be awesome too. And those are 2 websites. The one is to be able to check whether your test is actually, an approved test. And the other one is where you go to order your free 4 tests per household. So, and you literally just put in your name and your address and your email, and it gets sent to you from the website. So, and then the other part of the question, was when should you use an at-home test? So the real standard and making sure that you for sure are getting an accurate result for COVID is if you go and you get what are called the PCR tests, which is the most sensitive ones, the ones that take a couple of days, usually a day or 2, to get the results, because they're testing for the actual genetic, that RNA I talked about, the genetic code of the virus. The rapid ones, the at-home ones, check. There are actually some PCR tests that are at home, but they're like crazy expensive, like $100 or something. The rapid ones, the ones you get in 15 minutes, 10 minutes, 15 minutes, or 30 minutes, those are checking for the material that makes you sick in the virus. And so that's why they're actually less sensitive, because you have to have enough of the virus in your system for it to pick up on that material that the virus puts out there that causes you to get sick. And so using an at-home test, I highly recommend, if you're going to do it when you actually feel sick. You're going to be more likely to have enough of the virus for it to be an accurate result if you do it. If you hear from your friend, oh, I got COVID, and you were around them, 2 days before, and then you test that day, you get a negative, it's not a real one, right? Because you don't have enough of the virus for that home test to pick up on, right? And so you might go about your merry day thinking, I'm fine, I'm COVID free. But actually then if you were to test those 5 days out, you might actually get a positive. So that's the piece, is it has to build up enough in your body, enough of the virus has to multiply, duplicate, replicate in your body for those at-home tests to really find that you have COVID. And a good marker is if you're feeling really sick, then you can use the at-home tests.
Okay, thank you for that, Dr. Taylor. Um, Thank you again to all of our panelists for for engaging in such a good dialogue. We're now going to move to the Q&A section of the discussion. We have a few questions there now, but if you still have questions, please put them in the chat. Um, and we'll read them. Either a question for the Taylor or for any of our other panelists. The first question that we asked was submitted by Jamie, and it says hospitals are overwhelmed by unvaccinated persons needing care, limiting access to others like victims of car accidents, heart attacks, or any other issue. Would you agree with those who say limiting services for the unvaccinated is something that we should be doing? What is fair in this case?
Yeah. Whew, that's tough right out the box. Okay, so that's hard, right? Because I am a firm believer that healthcare is a right, not a privilege, right? And that no matter what your situation or your life choices or what you decide to do for your own body, that if you're sick, then you should get the right care, right? And it is one of those situations where right now we have a virus that has overwhelmed our hospital systems in a way that modern medicine has never seen. And so, we are having to postpone elective surgeries. We are having to sort of put off things, and even people aren't going to the doctor because they're afraid about getting COVID. And so they're showing up in the emergency departments even more ill than they otherwise would have, right? So people with diabetes, for example, a lot of folks have been going for a really long time with very high sugars, and then they get what we call diabetic ketoacidosis, which is a diabetic emergency, and then they have to go to the hospital. So you get the hospital having to manage and deal with all these different things. But the reality is the person who can't breathe because they have COVID, regardless of their choice of vaccination, has every right, in my opinion, to be able to get medical treatment as the person who has the diabetes and chose not to go to their doctor before because of their own fear of COVID, and have been living with these high sugars and got to an emergency. And so I don't believe that we should make care available to certain populations and not to others. And let's just be real, who are the people who are going to get affected by making sort of stratifying who gets what services? Is going to be our communities, right? And so, we don't want to set ourselves up for poorer care because of decisions that are being made. I personally have family members who have chosen not to get vaccinated. I would never want them to contract COVID and then not be able to get care because of the fact that they made that decision. I would want my father to live, right? And so if you kind of think about it from that perspective, the reality is Black and brown folks would be the most affected by these kinds of policy decisions.
Thank you for that. Anybody else the panel wants to add to that or have an extra comment to that? Like not. The next question for the public is from Valerie. Can you anticipate when children under 5 years old can be vaccinated? Parents with unvaccinated children are still at a square one when worrying about exposures, especially parents of those kids under 5. So what do you think?
Yeah, I know. My little boy's 4. He hasn't seen his grandfather in over 2 years because we actually had planned a visit to Washington State in March of 2020, and then we had to cancel it because in Washington State had one of the first outbreaks of COVID, and so we haven't gone to visit my father in that length of time. So I get it. Like I can't wait until he turns 5 so I can get this vaccine. So what is happening for the under 4 is that they are needing to do additional studies for them because the dosing and how you can give it isn't a straight line. So the reason why it came out for adults and then for teens and then for 5 to 12 was because the strategies and the dosing had to be different. And it's not just sort of like proportional. So even under 12, 5 to 12, the dosing and how it comes in even the vial is entirely different for 12 to 12 and older. So they're trying to make sure that they're able to get the right dosing for the under 5, and that's a big big range developmentally, right? So if anybody has kids or you live with a child that's under 5, you think about what they were doing as a baby and how their bodies functioned as a baby versus at 4. We're talking about 4 years, but there's so much that changes in the body. So you have, it's so much more of a, like it's much more nuanced as to how you can come up with a vaccine for this age range. They're hoping, actually, it's looking like it's on the horizon within the next few months, but they've had to put it back because they really want to make sure they get the dosing right, because there's been really good outcomes for some of the population, but it hasn't been effective for others. So they're trying to figure out how to find that right sort of amount of the vaccine. So to be honest, as much as I want my son to get the vaccine, I'd much rather that they get it right than to put it out faster.
Another one from one of the students. What is your opinion on schools being open during surges of positive cases?
Yeah. To be honest, my opinion on this has changed throughout the pandemic. I initially was like, oh, we got to keep kids safe. We got to make sure we don't cause any further spreading of the virus. But what we wound up having, and actually just before this meeting, I was on a meeting with an advocacy agency, and they were talking about the impact of COVID on kids, on graduation rates, on access, actually even just going to school, right? So we had a really long period where kids were having to be remote. And I think that our community health workers, you guys are in high school, right? Yeah, so you guys, oh, no?
Yeah, we are.
So you guys know that so much more real, in such a more real way than even I, right? Is that all of a sudden you can't go to school anymore. You're having to figure out, right along with your teachers who have no clue, vast majority of them, how to deal with like teaching virtually, right? I'm sure even just the idea of figuring out Zoom to begin with was really hard. And figuring out how to get yourself organized around that kind of situation. So at the real basic level for kids and teens who were organized enough to be able to continue to thrive in that environment, kudos to y'all, right? Because there are a great number of kids who were really left behind. There are a great number of kids who just didn't show up anymore, right? And when it was time for schools to open back up, they just didn't enroll. And we had this mass difference in like the number of kids who enrolled from one year to the next. They didn't all move to Florida, right? They just weren't in school. And those kids were just lost. There was nobody checking up on them. There was nobody really making sure that they had the education that they needed. And then to be honest, again, the kids that were most affected were our Black and brown kids, were kids in our urban communities, right? They didn't have the kinds of supports. The school systems didn't set it up the way that they needed to because it was all done on the fly. I think that being able to give options for kids, and I think being able to figure out how to reduce like severe illness is really important. And we have now a tool of remote learning that we didn't have before, but I don't think that it needs to be the primary tool. Because you will again have more and more kids who are falling behind, who are not able to keep up with their education, who get frustrated. So even if they're going, they get frustrated because they can't understand what's being taught because it just goes at a pace and they can't get that interaction that they need. So I really do believe that it's important to figure out a way to have kids to be able to be safe and be in schools, and really come up with policies that really think about this in a way that really kind of allows the schools to sort out what's appropriate for your community. Because we can make blanket policies, but it's inherently going to leave folks out. And so how do we empower schools themselves to be able to figure out what works best for them in order to make sure that the kids can get the education they need? So.
And it happened to us at the university level too, right? We had students who, I just saw a student the other day that I haven't seen for a while. I said, wait, I thought you would have been done. So no, because my senior year, she pushed when the virus first came, but she said, I'm not gonna go online. I don't want to do that. I don't feel comfortable. And so how many took the decision? Several. And so think about seniors who should now be working, part of the workforce as social workers or what have you. In our department, should be social workers who still stayed at home or doing whatever odd jobs they were doing and postpone their education for a year. So that's social workers you don't have in the fields or students who are not earning. So economically it has an impact. And so they're delaying their education for a whole year because they don't like the online. And so there's a lot of similar decisions. Students like, I'm not gonna go, or then their life take a different turn and they don't return to university because they didn't want to, similar to what you're saying. So it's related. I
Can I
have,
just comment on that really quickly, Dr.
yeah,
Rojas?
absolutely.
That puts another lens on the healthcare worker shortage, especially in mental health, right? And I'm a part of a lot of those conversations at the state level. But that's really really important. That the amount of folks that are pulled out of the workforce, and also probably because they couldn't go to school, because how many people now couldn't even work and couldn't sustain, so they're helping to support their family. All these decisions that you had to make because you couldn't go into class. Yeah. Thank you.
I have a few more questions from the public. I have another one from a student. So it's about the Johnson & Johnson vaccine. Is it not safe anymore? Why was it taken off the market last year and then this year again? Why is it no longer the preferred vaccine?
Yeah. So the Johnson & Johnson vaccine had a few things that sort of led to higher rates than what you would see in the broader community as far as side effects go. So there were concerns around the impact. I wasn't familiar that it's currently off the market, but maybe I just haven't been up on it, because I have to be honest, I don't really study the Johnson & Johnson vaccine because it's not something that I would recommend my family to take. I think that if you are only willing to do one shot and you're not willing to do anything else, it's better than not, because still the risks of COVID far outweigh the side effects of the Johnson & Johnson vaccine. But yeah, it just doesn't have the same efficacy, and it's an older way we do vaccines, and so people can feel comfortable with knowing that technology has been around longer. And so if that helps you feel comfortable and allows you to get vaccinated, it gives you some degree. But now they're saying in addition that you should get a booster, right, if you're 5 months out from that with the mRNA vaccines. And so it's just not as effective.
Thank you for that. I have another one from a student. Is there anything else we can do besides social distancing, masking, and hand washing to protect ourselves? What about supplements or breathing techniques? There's maybe non-traditional or natural solutions.
Yeah, so that's really important, and it doesn't get enough airtime, right? Is thinking about what else is in our power. Really doing what will help you be healthy is the most important thing. So trying to keep yourself with a healthy diet, exercise, all those things, because one of the things that we have found out is that those who are have comorbid illnesses or other illnesses like diabetes, chronic lung disease, hypertension, high blood pressure, sorry, I'm trying not to use medical terms, high cholesterol, a history of heart attacks, those kinds of things, you're at higher risk for getting significant illness from COVID. And so being able to make sure, for example, if you have diabetes, being able to keep your blood sugar levels stable and steady. Exercise is huge. What we know is that exercise actually really boosts the immune system. There's an interesting interplay with something called cortisol, which is a stress hormone in our body that can get out of whack when we're unhealthy. So essentially what happens is that we kind of have high levels of the stress hormone, we don't need them, and low levels when we do, because the sort of feedback system from our brain to our adrenal glands that creates the cortisol goes completely out of whack. Being able to exercise actually helps to regulate that. Having healthy foods and really feeding your body in a way that allows your body to have like nutrients that naturally help your body know how to like defend itself. There are some people who talk about a lot of different supplements. I don't want to go into that because there's just not enough research out there to really like say like this is the thing I'm going to tout for you to take if you are trying to prevent COVID. But I can say without any doubt, eating fresh fruits and vegetables, getting regular exercise. And right now the recommendation is 20 to 30 minutes of moderate exercise per day has a dramatic impact on your overall health. So it is, even just going for walks for 20 or 30 minutes a day. These are all really, really important. We know actually that COVID has a greater effect on fat cells. So the more adipose or fat tissue you have, the oftentimes the sicker you are. So an example is my mother. My mother is obese, and she got COVID, and she actually got quite sick from it, and that's actually what has been seen across the board, is that there's the COVID virus likes fat cells, and so being able to be healthy, and it's not even just about losing weight or anything like that. It's about really having regular exercise, helping your body again with those cortisol levels and keeping yourself active. All of those pieces are really, really important in general and make a big difference with how sick you might get from COVID.
All right, thank you again, Dr. Taylor. So I think we had reached that time of wrapping up. And as we wrap up, we have another poll to obtain your feedback on tonight's event. I think we're gonna put the poll up again. So to again, how you feel about the discussion and how you feel about what you heard. I want to thank our panelists, Dr. Taylor and the community health workers from the YWCA in New Britain. Again, Diana-Lise, Sumai, Madison, Alina, Itzel, Kwadi, and Tiana Lee. Thank you for the time you afforded us today. We truly appreciate your time tonight and all of what you do to keep our communities healthy, to outreach, to talk to residents. All these community health workers, Dr. Taylor, is very important, especially without pandemic is extremely important. With the pandemic and everything that's going on, it's even more important to communicate, to outreach, to talk to our residents and to let them know what options that they have, what things can they do. We are grateful for everyone for tuning in and submitting questions. Thank you for that. If you have any additional questions about today's discussion, please email Dawn Fuller. I think her email should be put in there. If you would like more information about the YWCA and their programs, please email Sumai at cclark@ywcanewbritain.org. And Fuller was dfullerball@hesct.org. If you would like to get involved with either organization, we have posted social media handles in the chat. This session has been recorded and we hope to distribute it shortly so you can rewatch it, recommend it to friends, spread it around so many people can hear what we talked about. That's the good thing about this kind of tools, that they record it and it can be watched again. So it could be continue to live online. Have a wonderful rest of your evening. Again, thank you everyone for participating. Thank you to all that were here. And again, here in the chat, we have some of the emails that we were talking about to reach out to us or communicate with us. Thank you very much and have a good night, everyone. Thank you.
Thank you.
Bye.
Thank you. I have a question. I'm wondering if there would ever be an opportunity for me able to come out and see some of the work that you guys do, the community health workers, because I'm really intrigued. I had not been familiar with that you guys even existed or what you guys do. Would there ever be an opportunity to do that?
I'm pretty sure it will. I mean, I think it's a matter of
Absolutely.
yeah, reaching out with Valerie and Sumai, and because the students meet weekly and we have community sessions and we have community outreach projects. And again, I'm talking from Central when I work with them, but they will definitely welcome a visit, and like they'll probably prepare a good presentation for you as to what they've been doing, because they're constantly working with these grants, and they have to prepare annual projects.
Yeah.
Right. So they come in the fall and they work on a long-term project for the year, which sometimes I bring my class of community organizing to help them achieve that. And so they've been, every cohort is different, and some students stay in the cohorts, but they keep recruiting students, and they have done some amazing projects, with different goals. And so they would love to have you and share with you all that stuff. I'm pretty sure they'd be awesome.
That is so cool. Where do they get recruited from? From the schools, or?
From mostly New Britain High School.
High school, right.
And yeah, and other sometimes maybe out of New Britain, but it's mostly New Britain targeted. So it's mostly New Britain High School kids. Mostly female, I think. It's always been, because it's part of the teen center, and it's female. I think maybe there have been a male here and there, but it's mostly towards a group of females. And so, but the projects are about the community health, environment. How can I fix my community? Why does my community look like this? What can I do about it? Garbage, and how can we engage in the police, crime, safety? There's all kinds of different approaches that they have done. And the thing is, you take these kids, and they've been doing photo voice. So we train them on how to use pictures to transmit a message, right? And so the Photo Voice project has been going on for many years. So they take pictures of concerns that they have, and have the pictures tell a story. And then, but not only that, that's the research part of it. How can we create action out of the information you're gathering? So it's gathering information and teaching them research tools to then create actions about things that they want to change in the community. So it's great stuff.
That's amazing. I actually have, so I was a part of a program in New Hallville and New Haven that's sort of similar to that, only I don't know if these students get a stipend or not, but it is, I see in the chat the shout out about the photo voice. And it was so powerful and impactful, and I think it really, I mean, it certainly made a difference in the community. Unfortunately, they lost funding, so it hasn't existed since 2017. But I'm actually working with a psychiatry resident at Yale who is working with LEAP and is wanting to figure out how to work with LEAP in a similar fashion as to what you're doing with the students, and thinking about from a mental health perspective, how to work with students to sort of be ambassadors for mental health and supporting preventative measures. So.
And shout out on that issue of grants and funding. Shout out to Jamie, who are still here, and Val, and the people at the Y who really work hard behind the scenes to find out monies and get 3 years for this one, and then maybe another 5 years for this other one, and combine it into different projects. For me, being outside here in Central is really great. The work they have done for over 10 years with different grants and different opportunities to keep. I know the kids sometimes they don't see, or sometimes the communities don't see that work, but it's a hard work because again, if the funding's not there, then the projects end, and it's harder to keep them going.
Yeah.
But I've been amazed. It's my 5th year here at the university with collaborating with them. Sometimes I just put my name in the grants. They're the ones really doing the work and trying to find out different pools of money. So it's great stuff. So definitely you should come in. Absolutely. So I just, I know Jamie's here to talk to Val. I'll send her something right now, and Samaya, and we can coordinate a visit, because we'd love to have it. It'd be great.
Yeah, that would be very cool. However I could be involved.
Absolutely. Absolutely.
I would love that. Thank you so much for what you guys do.
No, thank you for everything, for being part of today and all the questions, and thank you for that. I appreciate it.
All right.
Well said, Dr. Rojas. Thank you very much, both of you, and Daniel for the back. And I hope everyone has a really wonderful evening.
All right. Thank you.
Thank you so much.